Let's take a moment and look at my appearance. Do you notice anything different? Does anything stand out? If so, can you guess what condition I have? If not, I will tell you. I have hemifacial microsomia. This is the second most common facial disorder behind cleft lip and palate. Now, most of you guys know what cleft lip and palate is, but not hemifacial microsomia. According to Children's Hospital of Philadelphia, 1 in 3,500 to 4,000 are born with hemifacial microsomia. That is about 0.03%, and that is still really small for being the second most common facial disorder. Today, I will be telling you about what hemifacial microsomia is and how it can be treated both aesthetically and functionally. According to National Institute of Health, hemifacial microsomia is a condition in which one side of your face is underdeveloped and does not grow normally. Now, there are different degrees to hemifacial microsomia. There are mild cases in which patients or people have a slight asymmetric appearance, but the more severe side, patients and people have deformities on the eyes, ears, and jaw, but mostly on the ear and jaw. Hemifacial microsomia can affect the appearance, and yet doctors have found ways to make patients and people look more normal. According to Stanford Children's Health, one option to help the jaw grow more normal is to use a rod-like device that will spread the jaw so that it can grow in between. So basically what they do is they would cut the jaw and put the rod in between, and after a certain amount of days, they would lengthen the space in between to allow the bone to grow in between. One option to allow the ear to look more normal is to have a full ear procedure. Now, according to Johns Hopkins Medicine, this procedure involves taking cartilage from a body part, mainly from the ear, or mainly from the ribs, and skin, and totally reconstruct it, and that's what I had. It doesn't look 100% like an ear, but it is the best that they have been able to figure out. While doctors have figured out appearances to help people look more normal, doctors have also found ways to help the certain things function properly. What I'm stating is mainly about the ear. There are two options that are involved in this. One, you could have your ear hole drilled, but there are many complications. One, it being infected, or the doctor could accidentally damage your eardrum. And as you can see, I did not get that. And the second option is having a BAHA. A BAHA is a bone anchoring hearing aid. According to University of Maryland Medical Center, a BAHA is an implanted device that goes around this area and helps conduct signals, sound, into electricity and send that to your bone. And from then you can hear. Now, as you can see, I also do not have this procedure, mainly because I can hear perfectly fine in my left ear. Now, if my left ear goes deaf, I will rethink about getting one of these surgeries and so that I can hear. From this speech, I have told you what hemifacial microsomia is and how it can be treated both aesthetically and functionally. Now, when you see people with hemifacial microsomia, you will now understand what they have been going through and that they are trying to look more normal. I hope that you may not look at us any different than you are, and that